I've been assigned to an extraordinary mission by M. Her order was to eliminate all bad doctors in St. Andrews. This is not going to be an easy task. My plan is to observe every doctor using embedded cameras. Mission start.
Who are you?
Recall what you did.
What's going on? I don't know what you're talking about.
What should you have done?
What are you saying?
I'm going to count to 5. You're gonna tell me what you have done wrong. Or else, you
Listen to me,
die!
I don't know what you're talking about.
1, 2,
It's a misunderstanding. I don't know what you're talking about.
3.
Talk to me. You know we can talk.
4.
Please, I can do whatever you want. Just tell me. Okay? Tell me.
Then tell me what you have done wrong.
I don't know.
5.
I know.
Are you a doctor?
Sit down.
Hi, Don.
Go on. Go on.
Oh, sorry. I'm here because I have a weird headache.
So, do you feel pain around here as well?
Okay, she started an interview without even checking who he was. Didn't even show any interest and asked coach question.
Well, I feel tiring most of the time and I vomited yesterday after I had a fight with my
You don't
girlfriend.
need to go into that much detail, you know what I mean, right?
So what am I into?
Well, it could be a lot of things, but the worst case scenario is that you might be suffering from a meningitis. But I think it's just a regular headache.
What? What is a
Oh, it's like an inflammation in the brain.
What? I have a brain inflammation?
It's okay, you don't have to worry about it. I think it's just a regular headache.
Alright. She assumed that without having enough information and just freaked the patient out.
Right, I'll give you some pills for that.
Are you sure that will do?
Are you a doctor or am I? No. Are you allergic to any medication like aspirin?
Yes.
Give me 1 second.
Other than bad manners, she also had poor medical knowledge.
So I write you a prescription of this thing.
But
You don't have to worry. Just take the pills I prescribe and you'll be fine. You can leave now, thanks.
what is this?
Hey, how was your day?
Oh, I just had this one patient, you know. It was so ridiculous.
Really? What did he say?
He freaked out just because of a normal fever. You know, I think the headache must have come from the fight with his girlfriend the night before. And why would he say that to me? You know, I'm not a psychiatrist or something.
I don't think you should disclose personal information about your patients to anyone, Pras. I mean, come on. We're doctors, and patients trust us, the least we can do is earn that trust and not disclose personal information.
Whatever, I don't care. Who cares?
Alright then,
Bye.
bye.
So after all that, she neither showed an interest nor empathy toward the patient as well as breaking confidentiality. Overall, she did her job poorly.
Copy that. May I now see how a good doctor should be?
Indeed.
Please come in.
Hi, Doc.
Hello, my name is Shaina and I will be your doctor today. Please have a seat.
Thanks, docs.
How would you like me to call you? Mr. Sahara?
K, please, K.
Great. Perfect, Mr. K. I'm sorry I kept you waiting for so long. I know you've been out there for a while now.
She started off very well and
Nice, alright.
So, what brings you here today?
Well, I'm having a headache and an eye pain as well as high fever.
Oh, how long have you had the fever for?
Probably more than a week now since I had a fever. It is really terrible.
Oh dear, that's a shame. May I ask, when did it start?
Well, it began with me having chills throughout the day, followed by a terrible headache and then fever.
Has the pain ever stopped in between?
Yes, very often, and my temperature would rise really fast once the fever came back.
Are you on any medication?
No, not at all, and that's why I'm here today.
It's good that you've come here today. May I ask, is there anything that makes the pain feel better or makes the pain feel worse?
that was a recent reply. She has just encouraged the patient to seek help from doctors in the future.
I'm sure what usually makes the pain worse is when I'm at work and the headache makes it hard for me to concentrate and I just have to force myself.
Right. Could you describe the pain maybe in a little bit more detail?
Well, the pain usually starts with a mild headache and then followed by a fever.
So, has the pain affected you maybe anywhere else? Has the pain radiated?
Well, most of the fever made me feel real tired with a muscular pain around my body. And I feel as if I just have gone to gym, with those muscular pains. And I also sweat a lot at night sometimes.
Haha, yeah. I certainly know how that feels. If you don't mind, may I ask some personal questions now to take your medical history?
No, certainly not.
How are you managing with your day-to-day life? Is there, how are you managing to go to work or doing your normal activities? How's it affected your lifestyle?
It's great. She's asking many open-ended questions. This will allow the patient to explain himself better.
Well, I'm living alone right now, so it's really hard for me to cope with fever once it occurs. And other from that, then it's nothing much. I just have to ask for permission for a day off, and that's how I have myself free today.
Can you recollect maybe what brought this pain on? Maybe something you ate or some activity that you did? Can you recollect anything? You remember anything?
I don't know how it really started, but it started around a week after I got back from camping with my friend in India.
Alright then, Mr. K. Are you allergic to any sort of medication?
Yes, I can't take aspirin.
I see, Mr. K. I will accordingly be prescribing you with some medicines. The symptoms you have described to me seem to characterize to a viral infection. If that is the case, you do not have anything to worry about as long as you take the medicines. However, judging that you have been experiencing a fever and pain for a substantial amount of time, I would like to request you to come in for a blood test tomorrow. This is to verify the illness you are suffering from. Your symptoms are closely similar to that of malaria, dengue, or maybe even typhoid. Accordingly, we will have to take a quick action to determine your illness. However, there is no need to worry. You're in safe hands. I assure you that everything will be just fine. Just please come in for a blood test tomorrow so I can diagnose your illness and provide you with the medication so you have a speedy recovery.
You made it all clear to me, and thank you very much.
No problem at all. Goodbye.
Impressive. And I have no comment on her at all.
You shall now commence second phase of the operation, elimination.
Roger that.
So annoying.
You have successfully recalled what you have done wrong. This will be your last chance. Go back and make it right.
And reported bad doctors started interview without acknowledging the patient, asked close questions and didn't show empathy, had poor medical knowledge and disclosed personal information. Good doctor reassured patient, had good medical knowledge, asked open questions, showed interest and empathy. Mission accomplished.